Now, our topic is all about determination of death and biological and clinical death. So here we will discuss now how could we determine death. So death, we will talk about death, types of death, and brain death. So although we discussed previously about brain death, but here we will discuss it more deeply. So I say death now, this is the analogy. No, it is a process rather than an event. So it means we say if a person undergo a death process, it has a sequence of events. So dili pwede mamatay lang kadayo no na walay mga pre-symptoms, mga pre-signs and symptoms. So meron yan talaga no before na mamatay yung isang tao. Siguro no if ever yung cause of death is by accident or for example gunshot no, in the head, so yung death niya is abrupt but meron pa rin yang process behind. So we have two principles that is related to death. We have clinical death and biological death. So when we say clinical death, now this is pertains to the brain death. Now the death, the cessation of the functioning of your brain. This is most likely because of the lack of oxygen and other nutrients going to your brain. And we have also biological death. This is pertains to cellular level. For example, if you have your client has diabetes and then the patient suffer from diabetic foot, so maybe because of the uncontrolled blood glucose level, it makes the blood viscous and it will prevent the circulation of blood and nutrients including oxygen to the extremities. So once the client has a wound in the extremities, it is difficult to heal and eventually it will going to a gangrene state, and if it is not managed well, so that part of the body will suffer from cellular death. So yung may mga documentation guys na nakikita nyo yung mga paa nila is kalansay na siya, nag-expose na yung bone, so most likely that is related to cellular death. Okay, so that's the two compelling principles related to death. So according to the registration of birth and death, Act of Section 2, it defines death as a permanent disappearance of all evidences of life and any time after live birth has taken place. So if those all characteristics of life cease to exist, so we can conclude that death happens. So two types of death. We have somatic death or systemic death. So when we say somatic, it means pertains to the body, or systemic means the systemic by systems. When we say molecular death, it pertains on the molecular level. So it could be associated with cellular death. So somatic death, when we say somatic death, it is a complete and irreversible stoppage of circulation, respiration, and brain functions. So we have Bishop's tripod of life, but there is no legal definition of death. Wala siyang legal definition. So it is important in resuscitation and organ transplant. So bakit natin kailangan malaman na what's the definition of this one? Because this is related to ethical issue when time comes that we want to resuscitate somebody. We want to resuscitate our client. As long as the circulation of oxygen blood is maintained to the brainstem, life exists. So one of most important molecule that we need in order for our metabolism to work is oxygen. So oxygen is the main ingredient for us to utilize ATP and break down it and to have power or in the form of energy or heat, and the byproduct of that one is carbon dioxide and ADP. So whether the person is alive or dead, can only be tested by withdrawal of artificial maintenance. So a person who cannot survive upon withdrawal of artificial maintenance is dead. So even though we could maintain, a cellular level, the health or the status of cellular level, systemic level, as long as that body could not survive on its own. No? Once we remove the artificial support, or for example, the ventilator or the artificial heart lung machine, once we remove that one and that person cannot sustain life, no, that person is considered dead. Not dead na siya. That's because he or she can no longer support, no, the existence or the functioning of the multi-system, 11 systems that our body has. So when we say molecular death, it means the death of cells and tissues individually, and which takes place usually 1 to 2 hours after stoppage of the vital functions. So individual cells will live on their residual oxygen for a variable time after circulation has stopped, depending on the metabolic activity of the cell. So that's why it is important. For example, if you see someone faint and fell down on the ground, and then when you assess the patient, the patient is not breathing and then there's no pulse, immediately perform resuscitation if you have a training to do so, because your the time that you are what you are racing against time, because in the cellular level now, if it is more than 3 minutes now, we could have significant cellular damage. For example, in the brain of our client, now after the brain of the client or the patient consumes the residual oxygen, or the oxygen that stays uh, in the blood or in the surrounding tissue of your brain cells, after your brain consumes that one, uh, now your brain start to feel the effect of deprivation of oxygen, and eventually suffer from cellular death. So nervous tissues die rapidly in vital centers of the brain in about 5 minutes, but muscle live up to 2 hours. That's why even though the doctor pronounced patient death by brain death, no, there would some instances that that person could still move, no, because of the muscles still alive. So, kaya meron yung mga, for example, unintentional sound that is produced, no, or unintentional twitching of muscle, movement of hands or extremities or phalanges. No. Yan. Then, we have also anoxia. This is a state where there is a lack of oxygen. So we say anoxia, according to Gordon, no, the stoppage of vitals depend upon tissue anoxia. So when we say anoxia, lack of oxygen, it is coming from the root word oxia, means oxygen, and means without. So anoxia means lack of oxygen. So we have different types of anoxia, with an anoxic anoxia, anemic anoxia, stagnant anoxia, histotoxic anoxia. So let's discuss ano ba tong mga type of anoxia, or a state where there is lack of oxygen that is delivering in our body systems. So when we say anoxic anoxia, when we say anoxic anoxia, no, this is a state when oxygen cannot reach the blood because of lack of oxygen in the lungs. Most likely, this relates to respiratory problems, COPD, asthma, tuberculosis, COVID-19 disease, no, or SARS-CoV-2. Now, this occurs from breathing in a contaminated atmosphere, or from mechanical interference with the passageway into the respiratory tract because of damage of the tissues, damage of the lobes of the lungs, or if there is a blockage of the windpipe or the trachea of your lungs. So when say anemic and anoxia, this is typically a type of anoxic which the oxygen carrying capacity of your blood is reduced, no, because there is a decreased red blood cell. We say anemic. The term anemic means there is a decrease, a significant decrease of red blood cells in the total blood of your client. Therefore, if you reduce the amount of red blood cells, because we already know that red blood cells are responsible of carrying oxygen and transporting it from the higher concentration which are the lungs and going to the different cells of our body. So uh, and also anemic anoxic would also like in also in poisoning, no, with carbon monoxide, nitrates, chlorates, no, coal tar derivatives, and acute massive hemorrhage. We also felt, the effect of anemic anoxia. What's the difference between the carbon monoxide and toxic poisoning is that instead we have reviewing the anatomy and physiology of our red blood cells. Now, we look on the chemical level on it. So when we try to examine our red blood cells, so it has a heme there which contains Fe, or the iron. So the iron is the site of binding of the oxygen. So there, the oxygen would bind on that site. Now, therefore, it gives the function or the ability or capability of our red blood cell to carry oxygen. So what happened in carbon monoxide poisoning is that instead of oxygen attached to the iron in the red blood cell, no, the oxygen can no longer attach to that one, no, because meron na siyang tinatawag natin na competitive attachment. Kasi nag-attach na si carbon monoxide sa ferrous. So there's no room for oxygen anymore. So that's why delikado tong carbon monoxide poisoning. And yun sa siya kadelikado, it's dangerous because carbon monoxide is odorless, tasteless, colorless. So you could never notice, no, that there is an increased level of carbon monoxide in a space. For example, if you have standby generator in your house, or for example you have motorcycle and you have a enclosed space, and then you keep, because of the brownout or there's no power in the grid, no, you chain on your generator, and then there's no sufficient uh, exhaust fan or exhaust system installed in that confined area. So what will happen is that through time, no, while you're using your standby generator, so the accumulation, no, the level of carbon monoxide accumulation in that room will increase. And if you don't have appropriate gadget or appropriate device to monitor and sense the level of carbon monoxide, you could never, no, you could never notice that there is an increased carbon monoxide in that space, and then suddenly you will fell on the ground, you faint, and then you suffer from carbon monoxide poisoning. So that's why it is not advisable, to turn on your, or to put your standby generator inside your house, no, especially if the house is enclosed, so there's no proper ventilation. Okay, so we have also stagnant anoxia. This is a type, which impaired circulation result in reduction of oxygen delivered to the tissue. So one of the typical example of this one is myocardial infarction, or yung tinatawag nating heart failure or heart attack. Then we have also embolism, no? Yung embolism in layman's term, ano siya, blockage of the blood vessels, no? Maybe due to air, maybe due to blood clots, maybe due to fats, no, and maybe due to amniotic fluid. So that's why marami ang cause ng embolism. So most likely it is a blockage. And also we have shock. So in shock naman, there is a temporary cessation of appropriate cardiac output volume because of the decrease of blood volume, no, maybe primarily because of hemorrhage due to injury or car accident, and maybe because of dehydration, maybe because of sepsis. No, it has same manifestation, and it could lead to cardiac arrest. If if the the process of it, will not be reversed. Okay. Next, we have histotoxic anoxia. This is a type of anoxia where enzymatic process by which the oxygen in the blood is used by the tissue are blocked. So, one of example, this one is cyanide poisoning. So, kanina sa carbon monoxide poisoning, it is the red blood cell that is being blocked, no, or being antagonized by the carbon monoxide, because instead of oxygen that is binding on your ferrous in your the heme of your red blood cell, now it is now the carbon monoxide is competing with the oxygen. But in the cyanide poisoning, instead the oxygen will bind to the cells in your body. Now the cyanide now will bind, now will block the receptor in your cells in your body. So even though your red blood cell can deliver a sufficient amount of oxygen, but the oxygen cannot enter into the cell because there is a cyanide blocking on its pathway. So that is histotoxic. It means on the uh, the tissue level, no? When I say histology means tissue. So histotoxic, there is toxic level of harmful molecules or substances that is poisoning or that is toxic to the tissue. So that's why tinatawag natin yan, histotoxic anoxia. So there is a decrease in the ability of your cell to utilize oxygen because of the antagonizing effect or action of cyanide in the cellular level. So this is the normal level of oxygen in arterial blood. So if you perform arterial blood gas assessment, so although this is a quite advanced na topics, but you need to understand that there's such thing na tinatawag nating arterial blood gas or yung ABG. No? And this test, we want to measure the amount of oxygen that is saturated in the blood. Ano ba yung pressure, the partial pressure of oxygen that is saturating the blood. So the normal is 90 to 100 millimeter mercury at 30 years and 65 to 80 at 60 years. So as you can see here, the larger the higher the age, the lesser the ability, or the lesser the amount of arterial blood gas or oxygen, arterial blood pressure that is saturating your blood. Then we have reduction to 60 millimeter mercury result in hypoxia. So if you have a client with a result of ABG, your arterial blood gas now has a result of partial oxygen that is less than or equal to 60 millimeter mercury, so the patient is suffering from hypoxia, or this is a situation where there is less oxygen saturation in the blood. Now, at 40 millimeter mercury, there is a severe hypoxia, and that may occur at 20 millimeter mercury. That occurs because our basic or the one of the fundamental molecules that we need for metabolism is oxygen. So without oxygen, we could not survive. So let's talk about the other side of this discussion. Let's talk about brain death. So how could we determine brain death? Now, historically, concept of death was that of heart and respiration cessation. So it means, pag sinabi nang namatay yung isang tao, typically, historically, we could say na patay na yung tao if there's no heartbeat and there's no respiration. So after that one, we could conclude that this person is dead. Kasi hindi na siya humihinga, wala na siyang heartbeat. However, there is a changes in medically in favor of a new concept, tinatawag natin brain death. This is a result of the advancement in technology, that is irreversible loss of cerebral function. So it is of three types. So we have three types of brain death. First, we have cortical or cerebral death. So, when I say cortical, so reviewing our anatomy and physiology, saan makikita yung cerebral cortex? Saan ba yun makikita? No? Can you still remember? Can you still picture out? Now, where is the specific location of our cerebral cortex? Someone could still remember the cerebral cortex? Uh,
The cerebrum, sir.
okay, cerebrum. How does it looks like? No, yung cerebral cortex. Other books would call that one the crowning glory of our brain. So the most easiest way to remember the cerebral cortex is that when you look at a stump, no? Makita niyo na ba yung stump ng puno na napinutol, especially for yung mga hardwood. So in the cerebral cortex would look like the bark of the tree. So it is the tinatawag natin the gray matter. Ito siyang bark. Nandito, if we slice the brain into a mid-sagittal section ba ngayon or coronal section, so we could see that there is a bark-like appearance. So that is the cerebral cortex. Then we have also the brain stem. So who could give some of important function of our brainstem? Ano ba yung importanteng function ng brainstem natin? Can someone remember ano yung function niya? One of the function of our brainstem? Hello guys. Are you still there?
Try
Or
na ako,
vital
sir.
function, sir.
Ano yan?
Vital function, sir, sa heart rate ug paghinga.
Yes, your brainstem is the um the vital center. So most likely if there's something happen to your brainstem, no, even though no, you could still you could preserve the body or you could sustain life by giving that person yung mga supportive devices, not just like your artificial lung and heart, um, your you intubate the patient, no. But no, after that one, if you remove, no, the patient still no can't sustain the respiration vital signs because the vital sign center, no, which is our brainstem, is now being destroyed. So wala nang magko-control sa heart rate, respiratory rate, no, cardiac rate, and other vital signs na meron tayo. Okay, then lastly we have the whole brain death, the WBD. It means lahat talaga ng part ng brain mo, no? Including the uh, right left hemisphere, the cerebrum and cerebellum, brainstem, the encephalon, mesencephalon, ano pa ba? Yung mga limbic system natin, pituitary gland, no? Lahat, pineal, and pons, and the rest of the surgical team. The rest of the brain structures. No? Pag sabi natin whole brain death, lahat talaga. Patay. So pag ganyan, no, we could still no, sustain life, but after we remove the supportive devices, patay pa rin yung patient natin. Okay? So those are the main three types of brain death. So we say cortical death, no, cerebral death with an intact brainstem. So it means the brainstem is intact, no, untouchable, functioning well. It functions to maintain the vital signs of the client. However, the cortical part of the cortex of your patient is now being destroyed. So there is no. It's just like an empty shell. There is a shell, but there's no one in it. No, because your cerebral cortex is where your consciousness being produced. Without your cerebral cortex, you're just a biological machine, no? Without personality, without identity. Just function your vital signs. That's it. But you cannot express yourself. You could not. You're not aware, no? Mawawala na yung consciousness. No? Maybe the you call that one the innate or primate reflexes, just like your blink reflexes, your digestion and respiration would still uh, there, no? But you could not you could not be awakened, no? Hindi ka na makapagsalita kasi wala na. Meron ka ng cortical death. No? This state of depth coma can be produced by cerebral hypoxia, toxic conditions, or widespread injury. So, hypoxia may be due to it could be drowning. No? Sino ba yung naliligo ng weekend? No? Be careful kayo. No? Do not go in areas na hindi kayo aware of sa mga, for example, sa dagat, no? Sa current, sa flow of current, especially if masyadong maalon, and do not go in the sea na nag-iisa ka lang. Dapat body-body system. And make sure to ask, no, kung sino mo yung sasama sa inyo, itanong mo kung marunong siyang lumangoy. Baka kasi hindi siya marunong lumangoy at saka, yon nalunod. No? At kasi malakas yung alon, hindi mo na siya masave. Okay? And if you would think, na sir, I don't want to go to the sea because I just want to go to spring water. Doon tayo sa may batis, doon tayo sa may falls, doon tayo sa may lake. Mas dangerous ang lake as compared to the sea because of your buoyancy factor. In the sea, because of the concentration of sodium in the water, so you would have a higher buoyancy. So it means you could somehow manage to float, no, in the sea as compared in the fresh water. So in the fresh water, so most likely yung concentration ng solute walang sodium, so most likely mas mababa yung buoyancy mo doon. So kaya mas mahirap lumangoy, no, sa sapa or sa batis as compared with in the sea because of that explanation. So if gusto niyo matutong lumangoy, doon kayo sa dagat kasi mas magaan kayo doon as compared in the sea or in the swimming pool per se. Okay? Next, usually if your cortical brain area is affected, usually our patient will suffer from coma. So magko-coma yan siya kasi, 'di ba? Sabi ko sa inyo, yung personality, yung consciousness natin nasa cerebral cortex yan, no? If ever mawala yung cerebral cortex, mawala yung personality mo. Just like a guitar, no? If there's still a six string, you could still make a high pitched tone. If wala na yung number 6 na string, so wala na talaga, no? Wala nang pag-asa. Wala na bang pag-ibig? Iba din yun. So, historically, concept tapos tayo dyan. So, let's proceed with brainstem death. Now, where the cerebrum may be intact. Pasabot sa intact, guys, no? It means untouched siya. There's no damage, no? The function is still the same. Through cut-off of functionality by the brain lesion. So, most likely, so brainstem injury, it could be because of vehicular accident. Yung mahilig mag-motorcycle dyan na hindi mag-helmet, no? Or magsakay ng sasakyan na without using the yung seat belts, or what else? Or yung patient na mayroong mga brain infections, or there is an increase in cerebrospinal pressure, CSF pressure, that makes that pushes your brain going through the foramen magnum, yung butas doon sa may occipital area na dadaanan ng spinal cord, no? Ipupush niya doon yung brain mo and then mag-herniate, no? Lalabas yung brainstem doon at saka ma-compress and then ma-destroy. The loss of vital centers that control respiration of ascending reticular activating system that sustains consciousness can cause victim to irreversibly comatose. Same then, and incapable of spontaneous breathing because as we already know that yung tinatawag nating brainstem is the center for your vital signs. No? This can be produced by raised intracranial pressure, cerebral edema, and intracranial hemorrhage. So, yung iba, pag subdural hemorrhage, no? Yun yung mga after sa yung nag-motorcycle, yung lasing, no? Chill with friends. Oh, nag ano sila, chill and then they forgot to wear helmet and then during uh, the way home, no? Na disgrasya, pagka disgrasya, walang kahit isang scratches. But after a week, ang nangyari, sumakit yung ulo, and then after 24 hours, namatay yung patient. The reason for that one, maybe because of some of factors na lacerate yung mga blood vessels doon, at saka nagkakaroon siya ng or bleeding, subdural bleeding. So it means konti-konti lang. So it progresses slowly. So that's why it is important, no, after any vehicular accident, especially if the injury or if there is a contusion or there is a injury in the head, no, kailangan talaga yung CT scan, no, para makita if there is bleeding inside the brain. Sir, question. Nabubuhay pa ba ako pag magkakaroon ako ng hematoma or hemorrhage, no, due to vehicular accident? I would say it depends on the area, no, kung saan ka na bunggo at saka severity of the injury. For example, pag dito sa mati ka na disgrasya, simba ko palayo, no, someone na lang, no, hypothetical person na disgrasya, and then nagkaroon ng hemorrhage, no, nag-bleeding sa loob, chances are pag arterial bleeding yan, no, kailangan mo, meron ka na lang 1 hour, no, na natitira. Chances are, dito sa provincial hospital, so pwede ka ma-attend. Most likely, ang mabigay sa'yo, bigyan ka ng mannitol to decrease the pressure of the brain. No? Bigyan ka ng mga IVs na hypertonic, the hypertonic solution, no? Para ma-decrease yung cerebral fluid in the brain, decreasing the cerebral pressure. After that one, pag masyadong malakas talaga, kailangan mo ng surgery. Unfortunately, we don't have neurosurgeon in here. So, pinakamalapit na may neurosurgeon is saan? Doon sa Tagum City. No? And pinakamabilis na route, no, papunta doon is 2 hours. So, most likely, mamamatay ka talaga on the way to DRH or sa Tagum. So, best way to prevent that one is keep safe. Always, if you are driving, do not drink, no, alcoholic beverages. So, if you are drunk, do not drive. So, if you have a long distance trip, or even though if it's in city driving, do not forget to wear your helmet, because wearing helmet saves life. And you have only one skull to break, you have only one brain to care of. So that's why choose a dependable helmet. Huwag kayong gagaya sa iba dyan na for the sake of aesthetic look. No? Maganda sila tingnan, ma-expose yung hair nila, ma-expose yung face nila, makikita yung porcelain skin, ginagawa, no? Nag-helmet, yung ginagamit nila is yung nutshell. Para saan ba yung nutshell? para yun sa bike, no? No, bicycle riding yun, hindi yun sa motorcycle riding, no? In terms of the speed, mas malakas, no? Mas matulin, no? Yung motorcycles compared sa bike. So do not follow those, no? Makikita nyo na nag-nutshell lang, kamotor na ka-nutshell. Okay, just in case, hindi natin alam, probability, no? Now, sabi mo, masyado kang magaling mag-drive, no? For example, for 12 years of driving motorcycle, hindi ka pa na-disgrasya. Huwag kayong paasa dyan sa mga hindi pa na-disgrasya. Kasi ako, no, natuto ako mag-drive ng motorcycle when I was grade 6. No? So, imagine, tagal na yan. Na-disgrasya ako way back 2017. Simula noon, parati na ako nag-wear ng helmet ko. Kasi wala na yung rewind. No? Pag madisgrasya ka, kaisa lang. And, dili pwede nga ikaw na nag-helmet, dapat pwede mo kang backride ka helmet po. And do not, no, wag yung anuhin na, usuhon nyo ng mag-overloading mo. Sige, saksang mga friends na, no, tag-upat, tag-lima, basta mag-igo pa, no. So, the capacity of motorcycle is for 2 lang yan siya. Walang 3, walang 4, walang 5, no. So, that's for your own safety naman. So, whole brain death, no, permanent cessation of functions of the cerebrum, cerebellum, and the brainstem. So, sabi ko kanina, no, lahat talaga ay affected na. So, wala na pag-asa. Patay din ang itong pasyente. So, various criteria for determining brain death. So, we have also Philadelphia Protocol, Minnesota criteria, and Harvard criteria. But, here we will follow the WHO determination of death, or the algorithm on how we determine death. So we have, first is, meron tayong 2 ways to determine death. We have the neurological arrest, and then we have also the cardiocirculatory arrest. So what's the difference between the two? So when we say cardiocirculatory arrest, this pertains to the cessation of the functions of your cardiovascular system. On the other hand, when we say neurological arrest, this pertains to the cessation of the function of your neurologic system. So let's go in detail. So when we say cardiocirculatory arrest, we have a responsiveness, not breathing, or only occasional grasping, and absence of circulation. So this is typical to person that is suffering from cardiocirculatory arrest. However, if we have person suffering from neurological arrest, so most likely the patient is now in coma, no, from clinical assessment or neuroimaging. So coma talaga sa patient. Catastrophic structural injury to the CNS or the cerebrospinal central nervous system is evident. So in the cardiocirculatory arrest, we have cardiopulmonary resuscitation as one of our what we call that intervention in order to reverse, no, or to try to resuscitate our client. So if failed, no, if we attempt this one and this is failed, so absence of circulation confirmed by the following means. So if not attempted, so same din yung process na. So individual has a DNR order. So hindi natin siya ina-attempt, no. For example, if patient has a DNR, okay, go ahead. So DNR order. So pag sabing DNR, do not resuscitate. So once the heart ceases to beat on its own, so wala na tayong magagawa. None. But still, we could give the appropriate care for our client. So treatment aimed to resuscitating life has been withdrawn. So pag ganon, wala nang, no attempt na. So it would lead to absence of circulation and can be confirmed by the following means. Ano ba yon? Clinical diagnosis. Ano bang diagnosis natin? Pag meron ng cessation of heart function, absence of central pulse on palpitations. Kung sabi natin central pulse, saan ba yun makikita yung central pulse? Reminiscing your, yes, saan?
Heart.
Yes, so we could assess the heart or the carotid artery, no? Or most likely, usually tinitingnan yan siya sa apical pulse or heart pulsation. So pag wala ka nang ma-appreciate na heartbeat, so it means nag-stop na yung pagpitik ng puso niya para sa buhay. Okay? Absence of heart sound on auscultation. So if you auscultate now, you could normally hear the sound, the S1 and the S2, the lub-dub, 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 no? Iba yung lub-lub, no? Kasi iba yon, no? Dapat lub-dub. Tsaka wala dapat S3. Absence of breathing, absence of pupillary response to light. So pag tingnan nyo ng pupil ng client no, ng retina, no, wala ng uh, light response, no, hindi na siya nagko-constrict, dilated na yung pupil ng client natin, yung pupillary response niya, wala na, dahil kahit na anong shine mo ng pen light, so if that criterion or criteria, no, will be met, so we could uh, rule out, no, the cardio, we could diagnose for cardiocirculatory arrest. So on the other hand, we have the neurological arrest, no. Hemodynamic stability is affected, no. Adequate oxygenation and ventilation. So meron siyang adequate oxygenation and ventilation because the heart and the lungs are working. Absence of severe hydroelectrolytic and acidic base equilibrium or alteration. So it could be na maapektuhan na yung acid-base balance. Absence of hypothermia. So walang hypothermia, no? So it will lead to CNS kasi pag may hypothermia, it could affect the cardiovascular system. It could slow down the heart function. So it would lead to cardiocirculatory arrest pag meron siyang absence of hypothermia. Absence of severe metabolic and endocrinologic alteration. So okay yung sa ABG niya, walang problema. So, absence of toxic substance and their effects, absence of clinical significance, neuromuscular blockers, and neurodepressant drugs on CNS. So, pag wala yan, hindi yan present sa patient mo, we could definitely look into neurologic arrest. So, clinical diagnosis, if there's coma present, absence of brainstem, reflexes, and apnea, that means cessation of breathing. So, we could definitely it is leading to neurological arrest. So in continuation, in the cardiovascular arrest, no, instrument test. So what we need to use, no, in order to further validate our the diagnosis of the doctor, we have a systole or pulses electrical activity on continuous ECG display. So pag nilagyan natin ng ECG display, usually ginagamit is lead 2. Pag wala, flatline, flatline yan siya. So, definitely, nag-stop na talaga ang heart mo. No? Absence of pulsatile flow in interarterial pressure monitoring. Wala siya pulse na. Absence of contractile activity using endocardiography. So, when we look at the machines, no, looking at the electrical activity of the heart, pag wala na, so, that most likely, high ang tendency na patay na yan siya. So, most likely, ginagawa nila is, nagwe-wait pa sila a minimum of 5 minutes after diagnosis to ensure the spontaneous return of cardiac or respiratory function. Kasi may nangyari dyan, guys, no? Pag declare na patay yung pasyente, after 5 minutes, automatically, on its own, na-revive yung patient. So, that's why yung iba, nagwe-wait talaga sila ng 5 minutes. No? Baka kasi, babalik, no? Kasi, sometimes, yung effect ng resuscitation drugs natin, for example, epinephrine and norepinephrine, so pwede siya ma-delay. So pwede na mabalik, no? But, no, pag dili na, so it will lead to death. Patay na good siya. So, then we look at this next box, no, the confirmatory testing for the neurologic arrest or brain death. So, primary, supratentorial lesion. So, usually makita nato na siya sa parts ng brain sa tentorial area, no, katong murag sheet, no, na nag-divide sa imong ventrices in your brain. So man ang tentorial area. Pag mayroong lesion dyan, na observed period according to etiology, second clinical examinations, and we could use EEG, no, the electroencephalograph, no, it looks at the brain functions, no, pag okay, pag wala nang brain waves, the alpha and beta waves. Pag wala na, so brain death na siya. Primary in infratentorial lesion, so baba sa tentorial area. Instrumental test, EKG, and perfusion test, no? If meron pa bang blood perfusion doon. So pag wala na, yan talaga, hindi na makita yung expected na result natin, it will lead to death. So that's the difference between the two, no? The neurologic arrest and cardio circulatory arrest. But in our local setting, most likely we are using the cardiocirculatory arrest as our method or our way to determine if a person is dead or not. No? Kasi sa neurologic arrest, no, wala tayong EEG dito. No, wala tayong electroencephalograph and wala tayong mga expert in terms of yung mga physician that is expert on neurology. So that's it. That's it, guys. Now that's the end of our discussion. Do you have any question related to our topic this afternoon, guys?
I question, sir.
Yes. What's it? What's about it?
Sa hospital setting, good, sir.
Yes.
Kanang maka-declare ba ta patay ang pasyente, sir, without ECG, sir? For example, sir, ang kuanon lang sa doctor, sir, kay ang ang heartbeat nga kuan, sir, ang breathing sound lang, sir, og ang kanang pupillary reflexes lang, sir. Walang to, sir.
Okay. So ito ha, let me clear you guys know na ang the the pronouncement of if a person is dead or not can be only be performed by a physician. So dili ta pwede as a nurse, "Doc, pronounce dead ang pasyente at time blah blah blah." No, dili ta pwede ana kasi only a doctor lang. To answer your question regarding with can a doctor diagnose a patient with can pronounce a person dead or not, no, by just using the the heart rate, no, and saan ba yun? Heart rate and the pupillary
Breathing, sir.
reflex. So we need to, no, looking back at this algorithm, so we need to met the criterion. Ano ba criteria? Ano, absence of central palpation. So, yes, pwede. Also, auscultation. Ano pa? No? Kailangan pa natin to i-met, no, itong instrumental test. Without this one, we could still, no? Siguro we could, but wala tayong sufficient evidence. So, usually it is required, no? For a physician to pronounce a person dead, no, kailangan meron talagang ECG reading. Na? Kasi magtatanong yan bakit walang ECG reading? Wala ba kayong ECG sa hospital? That is commonly being used in the hospital. And that is part of the criteria, no? In our algorithm in order to diagnose cardiocirculatory arrest or a person dead because of this one, this clinical manifestations. So, to answer kung pwede in circumstances na wala talagang ECG available, but if na, no, why not use the ECG machine? In legalities, no, we should follow this one because this is the basis of it. Okay? Other questions? Yes, Mr. Sanchez? Follow-up questions?
Good afternoon, sir.
Yes.
Kanang concern ba ang agreement ba ng DNR, sir?
Yes, that is a contract. No, do not resuscitate. So that is what we call advance directive. So that is a document, a piece of document, a legal document that is binded. No, meron siyang witness. No, legal document that has an instruction. No, of what the healthcare provider will do, no, after the function of heart cease to exist, if after the heart stop to beat. So pag nasabing DNR, so do not resuscitate, so hindi mo talaga sa i-resuscitate. Kasi pag i-resuscitate mo na yan, no, you are ano na, may kasalanan ka na, no? You are violating the ethical principles of autonomy. So,
Kanang,
gibuot na mo. Yes?
sir, follow up, sir.
Mhm.
Ang DNR agreement ba, sir, kay kanus siya ihatag, sir, or ang rephrase sa akong question, sir, kanang ang severe patients lang ba ang hatagan sa DNR agreement, sir?
Most likely, no, logically, ito lang mga patient na in a critical situation. Okay? At yung patient naman na okay lang yung ano niya, why you need to give advance directive with DNR? Na okay man siya. And most likely, ang DNR is most likely associated siya sa kanang uh, mga terminally ill, no? Sa cancer, for example, o kanang old age na taga, wala na siyang mga relatives, mga ganon. No? Hindi na siya, kanang, wala, there's no more in life no, na gusto niya mabuhay pa. For example, if terminally ill na siya, then wala siyang relatives, so mag-DNR na lang siya. No? Kasi, why so sa point of view ng client natin, no, he or she might think na why should I no fight for my life if there's no life in it. So mana usually naga DNR siya, and kanusta siya dapat i-kuha ng DNR. So most likely kanang able pa ang pasyente, makastorya pa ang pasyente, makasign pa ang pasyente, kasi if the patient can no longer di na siya makasign, so wala DNR mahitabo. Or else, na if ingon ana, usually ang ginabuhat sa uban pag tan-aw gyud nila nga discompleted na sila sa ilahang consciousness, yung uban is mogamit sila og power of attorney. Naa sila'y legal representative. For example, ang legal representative nako, for example, di nako I could no longer consent no sign for any advance directive documents. So ihatag na nako ang decision sa specific member of the family or kakilala nako nga siya ang legal nga ako nga mo decide never unsay mahitabo sa kuha. So that is binded by the power of attorney. Okay? Is there any other questions?